of the triggers are lesser because there's a soothing background sound that comes in. Okay, and for an older child, we can always make make the child listen to some sounds or soothing sounds as a sound therapy background sound with an earphone or even in the speakers, whichever is comfortable, whichever the child likes. So using that will help. Child wants to read and the child doesn't want to get disturbed from the sound. So having a background sound will give you that contrast and will help overcome both hyperacusis and misophonia. Now, the second method that an audiologist would do or should do is called as the desensitization or gradual exposure. More of a gradual exposure therapy. This is a tried and tested technique even in psychology as well. So where we expose the child to the triggers. For example, hyperacusis, how we do that is we make a list of the sounds which are bothersome to the child and we rate it from least bothersome to most bothersome, and we start off with least bothersome. We will expose the child to a low level sound and gradually increase the intensity. For example, the child has difficulty tolerating it only when it goes to 50 or 60 decibel. We start from 20, 30 and then gradually increase the intensity to 35, 40, etc. so that the child gets used to it. And gradual exposure, especially with children with autism, we cannot directly do with the triggers. What we recommend is we mix it with the soothing sound. Okay, so imagine the child gets affected with the vacuum cleaner sound. So we mix the vacuum cleaner sound with the music that the child likes. Okay, we mix it and then try to provide it so that the child gets less aversive to these sounds and he'll be able to accept the condition in a much better way. In a real life situation, when the actual vacuum cleaner sound comes, the child is better ready to listen to the particular sound, because desensitization is something that is used to overcome phobia, right? And if somebody is afraid of spiders, so how do they start therapy? Is they show the spiders picture, and then they show the spider from far away. Then they'll show the spider maybe covered in a box. So things like that. So then the fear would gradually start to reduce. Once there's a gradual exposure, so that would overcome. So this has been a tried and tested technique, but it has to be done by a trained audiologist, and it takes a bit of time. But definitely, this is proven research-wise and both clinically that this would work. And make the patient understand the difference between the hearing loss and the actual sound intolerance. And those children who have strong emotional and behavioral overlay, because if they have additional emotional issues, because especially in misophonia, where they have associated strong negative emotions, so sometimes they would require CBT as well. And whenever the severity goes slightly higher, what I would recommend is to recommend them for a cognitive behavioral therapy. So what they do in cognitive behavioral therapy is the changing the mindset of the child. So sometimes, you might think that it might be difficult because it's only talking therapy. How would you do it with the child with autism? But people have tried that. There is literature support, and I know colleagues who work with children with ASD who do CBT. So somebody who's trained, you can definitely refer to them and they can use the traditional CBT approach, and that has been proven to be beneficial for managing both hyperacusis and misophonia. And from an SLP point of view, modify your therapy environment such that you control sudden sound triggers. Okay, you modify the environment such that it is not sudden. Okay, and they are ready for and they are not getting bothered, in the therapy sessions, and they are learning well without getting triggered. And use visual supports or preparation cues. You tell them that we'll hear a loud sound soon, then the child is ready. So when the child is ready, you'll be able to manage slightly better. Train functional communication strategies like stop, quiet. Requesting for somebody to stop making the sound, requesting someone to be quiet. These are some of the goals that as an SLP can take to overcome or prepare the child for better management of the triggers, especially in the situations of hyperacusis and misophonia. Work on coping scripts and social narratives, and how you train the child in various methods so the child learns. Each child with ASD is different. You have those coping scripts, have social narratives, have role plays, and prepare the child for encountering such situation, how they should be able to manage, how they should think, how they should not panic and show tantrum. There are proper way of how to manage the situation is something that you should actually train. I mean, if we do all this, this will be counterproductive to the therapy of desensitization or CBT that they would be undergoing simultaneously. And parents' role is extremely important. So avoid overprotection. This is a common thing that is done is using earplugs, okay, or giving a noise cancellation headphones or using headphones. So what is recommended is, if you use a earplug or if you use headphones, it causes extra central auditory gain. It makes the condition worse rather than helping. Occasional use is okay. You know that there is a Ganesh Visarjan that's going to happen. So there will be like 15 minutes of loud sound. Then use the headphones. Only for those specific 15 minutes. That is fine. But it should not be like the child is always wearing it, predicting that there is a sound that will get bothered, etc. So if that happens, that causes more central gain and it affects improvement rather than helping. Keep a trigger diary, which are the triggers and how the child is reacting, and that one has to be discussed with the therapist and then modify it or tackle the issues with the appropriate intervention. Use graded exposure at home. So it has to be not just at the therapy session, you are giving the sounds and you're doing a graded exposure. So graded exposure should be done at home as well. And reinforce positive coping. The child was able to perform or cope in one particular situation, has to be positively reinforced, and work closely with the therapy team and then work together. So in general, hyperacusis, educational counseling is more important, and sound therapy, use sound enrichment and avoid prolonged earplug use. Desensitization, step by exposure to tolerated sounds, and CBT adapted for children for relaxation and reframing. So this is the approach that is recommended, and whatever I've telling you is from research and both clinical evidence based, and this is an approach that has been recommended for children with hyperacusis and for children with ASD as well. From a misophonia point of view, again, awareness and psychoeducation. How is it different from hyperacusis? So that is important for parents. Identify the trigger, create coping strategies for each trigger. I mean, how to increase the distance, how do we mask the sound so that there are no more triggers. Behavioral management, you can do a desensitization training, and parent and teacher support. They should avoid punishment and encourage coping. CBT elements like emotional regulation and all these are important. Definitely a multidisciplinary collaboration in misophonia is a must, where a psychologist, occupational therapist and SLP would work together along with an audiologist to help individuals with misophonia as well. So the case example that I said, 8-year-olds, what we did was, first one was parental counseling. We reassured education about what is hyperacusis and misophonia, so that was constantly being done. And an audiologist introduced low-level background noise at home, worked on gradual exposure therapy, and SLP used social story of canteen sounds and talk requesting strategies. This was done by an SLP as well. And after 3 months, so there was less ear covering, improved tolerance in therapy, and child was able to eat. So this is the progress that we saw in 3 months. So if you properly do these techniques, definitely we can see real life improvements in children who are suffering from hyperacusis and misophonia. The key takeaways that I want to talk to you is about hyperacusis is loudness intolerance, and misophonia is the emotional reaction to specific trigger sounds. Both are highly relevant in children with autism spectrum disorders. We require a team approach, that is an audiologist, SLP, OT, psychologist and parents. All of them together should help these children. And goal is coping, participation and quality of life improvement. We are not working of any cure, but helping them to have a better quality of life and better participation in the various life activities. So I want to end with this quote: when children hear the word